Now we switch for the final management, or we switch for the investigation, and later on the final decision regarding the management of the fertile male. First of all, I have to send him for what we call the seminal fluid analysis. And the seminal fluid analysis, should the patient have an abstination period from making sexual intercourse for 2 to 4 days, or to be more precisely from 48 hours into 96 hours. And the patient should be abstinent from doing any sexual activity during this period. According to the WHO parameters, the abstination period should be between 2 to 4 days. Why? Because spermatogenesis, or production of the sperm, is a daily procedure that can affect by the environment, by the illness, or by the certain food taking, and the sperm count may be different, and sperm activity may be different from day to day. So we have to be more precise in taking the range of sperm production between 2 to 4 days. And also the author said that the sperm production may increase in a range of 15 million per mil per day, and sperm activity may be decreased after the day 5 of abstination. So the best period to take seminal fluid analysis is between the second 2 or 4 day after abstination. And also we cannot depend only on one seminal fluid analysis. We should send the patient for another seminal fluid analysis in the next few days in other lab, in order to exclude the laboratory faults or laboratory mistakes that happen sometimes. So we have to send him for another seminal fluid analysis in other lab, or even we can do even also 3 seminal fluid analysis in 3 different lab. We will speak about the parameters of the seminal fluid analysis according to the WHO. The abstination period, as I said, should be at least 2 days and should not exceed more than 4 days. What about the macroscopical examination of the seminal fluid? Regarding the volume should be between 1.5 into 5 milliliter. Any decrease in the volume below than 1.5, it means there is a problem in seminal fluid production. We know that the sperm introduce the testes introduce the sperm, which come from the testes into the vas deferens through the epididymis, and then the sperm will go into the seminal vesicle. So the main site for production of seminal fluid, it is the seminal vesicle. The presence of low seminal fluid volume below than 0.5 ml may indicate that there is a problem in the seminal vesicle, or even a problem in the ejaculatory duct. And the problem in the seminal vesicle, usually either there is obstruction in it, or even obstruction in the ejaculatory duct, or sometimes absence of the seminal vesicle in the one or both side, and this will result in decrease or decrease in the volume of the seminal fluid of below than 0.5 ml. In this condition, when we have a patient with low seminal fluid volume, we should do the following. First of all, I expect that those patients have a low libido or decreased in the libido, so I send him for hormonal evaluation and looking for the volume for the level of the serum testosterone. Second thing, I expect there is a problem in the seminal vesicle, or even maybe absence of the seminal vesicle, so I should send him for a transrectal ultrasound, because transrectal ultrasound is very essential in diagnosis any pathology within the seminal vesicle or within the ejaculatory duct. So the volume of the seminal fluid is very important, and the volume, a normal volume between 1.5 up to 5 mol. A low volume indicate there is even decrease in the libido or hormonal changes due to low testosterone, or may indicate there is a problem in the seminal vesicle or ejaculatory duct. But what about the volume more than 5 ml? I think it's rarely to see seminal fluid volume more than 5 ml unless there is long abstinence period, more than 4 days. This is about the volume. What about the color of the seminal fluid? The color of the seminal fluid milky whitish in color. That's undergo liquefaction within period of 5 to 13 minutes. And the presence of the blood in the seminal fluid, we call it hematospermia, usually due to problem in the seminal vesicle and a problem in the prostate. And also we can looking for the problem by transrectal ultrasound for the prostate and seminal vesicle. The presence of yellowish color in the seminal fluid indicate the presence of infection or pus. We call it pyospermia. In such condition, we can send him for seminal fluid culture and sensitivity. What about the liquefaction? As I said, that liquefaction, the seminal fluid is a milky, high viscosity, but undergo liquefaction within a period of 5 to 30 minutes. Then increasing in the viscosity or an increasing time of liquefaction indicate the presence of high viscosity in the seminal fluid, and usually this happened maybe due to presence of the infection, or maybe due to presence of antigen or antibody in the semen against the sperm. So we should also concern about the liquefaction time and about the viscosity of the seminal fluid. Then we should switch into the microscopical examination of the sperm. What about the sperm count? According to the WHO parameters, the sperm count should be at least more than 20 ml per million per ml of the ejaculate. So we at least should have more than 20 million sperm per ml per the ejaculate. A low level or below than 20 million, this may indicate there is a problem in the introduction of the sperm, and we will discuss these problems in the next few minutes. What about the motility? At least should be more than 60% of the sperm should be motile, and the degrees in the motility range, it means there is a problem in the testes. And the motility in general is divided into 4 types or 4 grades. Grade A, it means that the sperm which run forward under the light microscope, and this should be more than 30% or more than 25% of the total sperm. Grade 2, it means that the sperm which run forward for some distance and then return or even stops under light microscope. And also this grade B should be about 25. Grade 3, it means that the sperm run about in a circle, and grade 4, that we consider it immotile sperm. The motility of the sperm is very essential about the viability of the sperm, so the presence of immotile sperm highly indicate the non-viability of the sperm. What about the things that affect the motility of the sperm? Multiple factors that affect the sperm motility or increase the immotile sperm, like varicocele, like smoking, like hormonal changes, like even certain systemic disease like diabetes or uremic or even immunosuppressant therapy. All of these may affect the motility of the sperm. What about the morphology? At least should be more than 55 or 60% of the sperm should be with normal morphology. What I mean when I say morphology, it means that this have the shape of normal sperm, which is the head and the acrosomal part with the tail. Increasing abnormal sperm shape or teratospermia. This means there is also underlying pathology which could be due to radiation or radiotherapy, or maybe due to varicocele, or maybe due to certain agents or certain chemotherapeutic agents, or even maybe congenital, or maybe there's a chromosomal abnormality which affect the sperm morphology. Also, we should look for the presence of pus. A normal seminal fluid usually contain pus because when get from the prostate, it take normal floral which is present in the urethra, and the presence of 4 to 8 white BC or pus cell per high power field, it's normal in the seminal fluid. But when increasing to more than 12 white BC or more than 12 pus cell per high power field, indicate there is an infection within the genital tract, maybe within the seminal vesicle or even in the testes. But in general, when I have 12 to 20 white BC per high power field, indicate the presence of infection, and I have to send the patient for seminal fluid culture and analysis. This is about the seminal fluid analysis and the microscopical and macroscopical examination according to the WHO parameters. And after the patients come, and after the result of the seminal fluid appear, as I said, I should send him also within a few days into another lab in order to make confirmation about the result and to avoid mistakes that happen by certain lab. And after taking a full history, full examination with the initial result of seminal fluid analysis, I can a little bit take a picture about overall condition of the patient. Then I should proceed into next step, which is the management of this patient.